My name is Dr. Rodriguez. I am a weight loss doctor in weightrx.org. Did you know that in the rapidly evolving field of diabetes management, the emergence of new medications continually shifts the landscape, offering fresh hope and improved quality of life for millions of patients? Among these, tirzepatide has garnered significant attention. This innovative drug, developed as a treatment for type 2 diabetes, has shown promise in helping patients achieve better glycemic control. A key aspect of tirzepatide's effectiveness lies in its unique dosing regimen. Understanding this is crucial for both healthcare providers and patients to maximize the benefits of the treatment. Tirzepatide dosing. A once-weekly approach. Tirzepatide is administered once weekly as a subcutaneous injection, a significant departure from the daily injections required by many other diabetes treatments. This weekly dosing schedule offers a major advantage in terms of convenience, potentially improving adherence to the treatment regimen. However, the specific dosing of tirzepatide involves more than just frequency. It requires a tailored approach depending on the patient's needs, their response to the medication, and any potential side effects. Understanding the mechanism of action before delving into the specifics of dosing, it's essential to understand how tirzepatide works. Tirzepatide is a dual glucose-dependent insulinotropic polypeptide, GIP, and glucagon-like peptide, 1, GLP-1, receptor agonist. These two hormones play critical roles in regulating insulin secretion and blood sugar levels. By activating both GIP and GLP-1 receptors, tirzepatide enhances insulin secretion, suppresses glucagon release, and slows gastric emptying, which in turn reduces food intake and helps control blood glucose levels. The dual action of tirzepatide on both GIP and GLP-1 receptors sets it apart from other GLP-1 receptor agonists that are already on the market. This novel mechanism of action is believed to contribute to the superior efficacy observed in clinical trials, where tirzepatide has demonstrated substantial reductions in HbA1c levels and body weight compared to other treatments. Initiating tirzepatide treatment after the initial 4-week period. If the patient has tolerated the medication well, the dose is increased to 5 mg once weekly. This stepwise approach is crucial because it allows the body to adjust to the medication, reducing the likelihood of severe side effects while gradually ramping up the therapeutic benefits. Titrating the dose based on patient response. The flexibility in tirzepatide dosing allows healthcare providers to tailor the treatment to each patient's unique needs. After the initial titration to 5 mg, further dose adjustments can be made based on the patient's glycemic response and any side effects experienced. The available dose options after the initial phase include 7.5 mg, 10 mg, and 12.5 mg, with a maximum dose of 15 mg once weekly. For patients who achieve good glycemic control with minimal side effects at 5 mg, maintaining this dose may be sufficient. However, if further reduction in HbA1c levels is needed, or if the patient's weight management goals are not being met, the dose can be increased incrementally. The decision to increase the dose should always be based on careful consideration of the patient's overall health status, including kidney function, cardiovascular health, and any other comorbid conditions. Monitoring and managing side effects. As with any medication, tirzepatide is not without potential side effects. The most commonly reported side effects include nausea, diarrhea, and decreased appetite. These are typically mild to moderate in intensity and often diminish over time as the body adjusts to the medication. To further minimize these effects, it's recommended that patients take the medication with or without food and stay hydrated. In some cases, more serious side effects may occur, such as pancreatitis or severe allergic reactions. It is vital for healthcare providers to educate patients about the signs and symptoms of these conditions and to establish a clear plan for what to do if they occur. Regular monitoring of blood glucose levels, renal function, and overall health is also essential in the early stages of treatment to ensure that any adverse effects are identified and managed promptly. The role of patient education and support. Patient education is a critical component of successful tirzepatide therapy. Since the medication is administered as a subcutaneous injection, patients need to be trained on the correct technique to avoid issues such as injection site reactions or improper dosing. Many patients may initially feel apprehensive about self-injecting, but with proper guidance and support, most can become proficient and confident in administering their medication. Support does not end with initial education. Ongoing communication between the patient and healthcare provider is crucial for adjusting the dose as needed and addressing any concerns that arise during treatment. Brought to you by weightrx.org and fenterminuteclinic.com.